So now we will move to the second speaker, which is Ms. Silvia Gnecchi. Ms. Silvia Gnecchi is working as a specialized nurse in oncology, hematology, and bone marrow transplant at the RICCS San Raffaele Scientific Institute. Her clinical expertise encompasses the management of the hematopoietic stem cell transplant, cellular therapy, and CAR-T treatment for both adult and pediatric patients. Her commitment for professional development is further demonstrated through her leadership, and also she's working now she's working with the unit and support of a new pediatric transplant facility in Tanzania through ISBO, no-profit organization. It's an honor to have Ms. Silvia. She will talk to us about the impact of novel therapies on clinical nursing education. Welcome again, and the mic is yours, Ms. Silvia.
Hello, everybody. Thank you for the invitation. I try to share my screen and in the presenter mode. Okay. Good morning, everyone, and so thank you for joining this session. My name is Silvia Gnecchi, and today I'd like to explore how the rapid evolution of advanced therapies in transplantation and cellular medicine is reshaping clinical nurse education and learning. Novel therapeutics are challenging, and great consideration should be promoted on what nurses must know, how to learn, and how to implement in everyday practice. I have no conflicts of interest to declare. So, about clinical nurse education, I try to provide some definition. So, nursing preparation has always relied on a combination of theoretical knowledge, supervised practice, and mentorship. It's a process that helps nurses develop judgment, technical skills, and also the ability to make sound decisions in complex situations. But the environment in which this learning takes place has changed a lot in the last years. The complexity of today's therapies requires, in fact, a more structured and forward-looking approach to education. And this brings us to the therapies that are driving this transformation. In recent years, we've seen an extraordinary expansion of therapeutic options, engineered immune cells, gene-edited stem cells, target biological agents, and also new strategies to modulate the immune system. These innovations are improving outcomes, but they are also introducing new responsibilities for nurses. In fact, we are now caring for patients who may develop rapid onset toxicities, who require a very precise handling of cellular products, and also who need detailed education about treatments that are still unfamiliar to most people. In fact, there is also the need to promote multimodal training from the knowledge field to the practical one. So, how do we prepare nurses for this new reality? In this slide, we can see a list of some examples of advanced nursing training. And in fact, delivering high-level nursing care to individuals undergoing novel therapeutics requires a wide range of nursing competencies, each essential at different points along the treatment pathway. Within the broader multidisciplinary team, structured nurse education plays a pivotal role in ensuring safe, skilled practice and also shaping the patient's overall treatment journey. Examining the educational needs of the nursing workforce across the full continuum, it becomes clear how vital the contribution of specialist nurses, practice educators, and the wider team are in sharing expertise and supporting learning. Educational strategies should also strengthen collaboration with universities and referring nursing teams to promote continuity of care across hospitalization and follow-up. So, to meet these challenges, nursing education must become more and more diversified. We need a combination of structured courses, digital learning, simulations, communication training, and also a strong mentorship. So I'll deepen in the following slides these strategies list in this slide. So in this first table, there are some examples of strategies. Specialized postgraduate programs provide, for example, strong consolidation and master covering oncohematology, transplantation, and the cellular therapy areas. According to the country, the length of the course can change. Usually they are 1-2 years long. Digital learning platforms allow nurses to stay updated on topics like immune effector toxicities, infection prevention, and safe manipulation of chemotherapy. Nurses can easily access from their personal computer, smartphones, everywhere and at any time. Simulation and role-playing are demonstrated to be effective in practical training. It allows teams to rehearse realistic scenarios in a safe environment. They promote, in addition, also communication, manual skills perfectioning, and critical thinking. But training doesn't stop there. In fact, there are some more strategies which are written in this extra table. Mentorship, for example, remains one of the most effective ways to support new staff. Shadowing experienced colleagues during stem cells infusion or GVHD assessment provides insights that no textbook can offer. Peer learning activities like case reviews, reflective groups, share protocol updates create a culture of continuous improvement. And practical tools such as manuals, pocket guides, podcasts, and short videos can help nurses refresh their knowledge during some busy shift. Learning objectives should be negotiated between the educator and the learner according to Bloom's taxonomy. What is Bloom taxonomy? It consists in gradually reaching new competencies and skills through different domains, starting from the base level, which is knowledge, followed by comprehension, application, analysis, synthesis, and evaluation. So these elements all contribute to a broader set of educational goals. So what are the key elements of clinical nurse education? Effective clinical education must strengthen hands-on abilities, help nurse apply theory to real situations, and ensure that competencies are assessed regularly. It must also support professional development and provide a strong mentorship structure, especially for nurses entering high specialized areas like cell therapy. But we have also to understand who are the main stakeholders of this pathway, who actually delivers this kind of education. And here we can find the answer. A wide range of professionals contribute to nursing development, starting from clinical educators, preceptors, academic faculty, advanced nurse practice, and also unit leaders. This multidisciplinary involvement ensures that nurses receive consistent guidance across different learning environments and also at different times of the career. And speaking of environments, I provide in this slide some examples of where education is performed. In fact, learning can happen everywhere. At the bedside of the patient, at the nursing stations during the shift, in university, at home, and also increasingly in simulation centers. Academic programs provide the theoretical base, while clinical settings usually allow nurses to refine their skills in real time and in safe environments. But to maintain high standards, we also need a structured evaluation. So we also need not just somebody who has the competence to teach, but also somebody who has the competence to evaluate if the standard is achieved. Competence must be assessed on a regular basis. Annual evaluations help maintain quality, while new staff usually benefit from structured checkpoints at 1, 6, and 12 months in San Raffaele experience. In fact, we had designed a mentorship program which has these specific checkpoints. Clear job descriptions, but also ethical frameworks and standardized exam help ensure gold standards of competence. One example of standardized exam is the very new experience of EBMT. In fact, at the last annual meeting in Madrid, there was the very first exam for nurses that can help to assess competencies and also to give value to our job. Learning could be also be facilitated through team building and the regular nursing training need assessment. But it isn't so easy. To design effective training, we must first understand what the nurses actually need. So there is also the need of a target assessment. In this table, we can see some example I provide to better understand this nurse assessment need. Across the oncohematological field, the rapid expansion of advanced therapies has intensified the need for robust, standardized education for nurses, whose roles are central to ensuring safe and effective patient care. Some papers outline the complex clinical competencies required for new therapeutics and also highlight persistent gaps in nurses' confidence and access to structured training. So we have still some gaps and some difficulties. The increased complexity of treatments demands not only technical proficiency, but also multimodal skills such as toxicity recognition, interdisciplinary communication, and patient and family education. Yet, training opportunities are not mandatory, unfortunately, across institutions, leaving many nurses without the preparation needed to meet the evolving clinical demands. Collectively, the literature underscores an urgent need for harmonized, accessible, and practice-oriented educational pathway. Why? Because we need to support our colleagues, nurses, as frontline providers in an increasingly sophisticated therapeutic landscape. Educational needs fall into four main areas, always according the Bloom's taxonomy I was mentioning before. Starting from clinical knowledge, as you can read in this slide, practical and procedural skills, psychological and supportive care, organizational and standard of care issues. Now let me share how we have approached these strategies at San Raffaele Hospital. So in this slide, I talk about our experience in Italy. At our institution, we've developed a mentorship booklet to guide new nurses through their first month. We are building also a dedicated social media platform to share educational content and updates. And we have also created instructional videos on essential procedures, helping standardize practice and support nurses during busy shift. For example, another experience is the Tanzanian experience. And since 2019, we have been promoting through a no-profit organization Tanzanian nurse training for the opening of a pediatric bone marrow transplant unit. Finally, let's look at where we are heading. So I would like to conclude with some sentences, some take-home messages. Caring for patients undergoing advanced cellular therapies requires highly specialized preparation. International surveys consistently show gaps in training, in confidence, and institutional support. To address these challenges, we need harmonized training programs, more simulation-based learning, stronger education on toxicity management, and greater recognition of advanced nursing roles. As therapies evolve, nursing education must evolve with them. Investing in nurses means investing in patient safety and better outcomes. Here are the references of my presentation, and thank you for your attention. I'm open to some questions. Hello.
Holistic approach in giving your nursing education. I cannot find a single thing to delve into. But in your experience, what are the usual challenges that you encounter when you start giving your education? Though you have given all the approach, online, podcasts, simulation, mentorship, peer mentoring, do you still encounter challenges? And if there are, what are those?
Thank you for your very interesting question. The main issue isn't about the way to educate the new colleagues or the newly graduated nurse. The main issue is about the support of, for example, the institution, because education is performed during the shift, usually. To train nurses, senior nurse should work, so should take care of the patient, and at the same time should train also the new grade nurse. So the main problem we find in everyday practice is time. We lack of dedicated time out of our shift. But we are working on it, and we are trying some strategies, as I was mentioning in the presentation. For example, now in our mentoring program, we have some permissions. So the mentor can stay outside the shift. So the mentor doesn't take care of a group of patients during the mentor shift, and can dedicate his time to only train, to only educate the new nurses. So we have, moving on, we have this well-structured mentorship program that is very useful, very helping us to perform a better training. Of course, the other issue is that education and training performed in a self way at home, for example, isn't recognized in the working shift. So people should study by themselves in the free time. So somebody isn't so committed to spend the free time in the studying and in go in deep in bone marrow transplant areas, in hematology area. So we see that at the evaluation point, somebody isn't well prepared because maybe some steps aren't followed in the right way. But I think that every center should find a very tailored strategy that can be effective.
Okay, thank you so much. That's great.